So today we're going to talk about spondylolisthesis, or what you would also known as like when your vertebrae kind of slips forward. So we're going to talk about that as well as things, why this happens, and things that you can do to start getting you some results today. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients every day avoid surgery, injections, and medications while getting their life back. We often see people that have been to 4, 5, 6, 7, 8 different healthcare providers without results when they come to see us, and we are able to help them. So we love providing education to help you understand the body a little bit better versus just giving blanketed exercises, not really understanding why things are happening. So let's talk about what the disc does, and then we'll get into what the spondylolisthesis is. And so what our disc is we have bones on the top and the bottom, and in between there's this disc, and it's kind of like a gel-filled material, and it helps us move around that area. And so what can happen when you have a spondylolisthesis, or when your vertebrae shifts? You'll see it on the x-ray. We've seen this so many times with clients, and when they come in and they ask us questions, I'm like, yep, I'm pretty sure I know exactly what's going on and how we can fix it. And so that's what we're going to talk about. So what happens is that disc will get shifted forward. So you'll see one disc that's farther forward and the other discs that come back, and they're in the normal position. And so they may have symptoms of back pain. They may get pain down the leg. There's a lot of things that can happen. Now, if you get pain down the leg, you're going to have to be very careful. It's probably best if you go in and see a healthcare provider so they can know what you can and can't do. But I'll navigate your symptoms. I'll navigate this a little bit with you to kind of help you understand if you're making things worse or if you're making things better. And so when we see someone that comes in and they show us their x-ray and like, what can you do for us? Because the doctor says, I just can do injections and I'm probably leading down to having surgery. And my comment initially would be like, well, I guarantee you that right at that level, there's probably a fulcrum. And that's where the back is bending. That's the only spot the back is bending. So it's kind of like if you have your spine and you're just bending at one level. And so if you're always bending at one level, it tends to shift it forward. And that's a problem. And so what we find is that the levels above the disc, the levels above it, are super stiff. And so we've got to get those moving. And the levels below it are also super stiff. Now, we find this really common in the lower back. And so when we talk about the lower levels, we're also talking about the hips. Because if the hips don't move, the hip is in the ball and socket like this. If it doesn't move, it's going to take the back. Or if it doesn't move, it's going to take the back with it. And so it'll create that fulcrum. And so we've got to look at above and below. We've also seen this really, really common with people that have stress fractures, where they're getting stress fractures, it heals, and they get it again. It's the same concept. They're bending at that one level, and it's stressing that one level when the rest of the levels aren't moving. And so we're going to talk about what we can do to get everything moving, and that's what we're going to talk about next. So again, if you're having symptoms in the leg, we've got to be very careful. And what I want to kind of explain is that if your symptoms are in the leg and you're doing this exercise and you notice that the symptoms are less, or they're starting to move up the leg into the back, this is a good sign. This is a great sign for you. Okay, you're moving in the right direction. If you're noticing that the symptoms are getting worse, you're hanging out there and you're like, okay, no, wait, because it can get worse initially, but then it should start getting better. If you're noticing that it's not doing that, then you need to stop, and we need to get you to someone that understands the body to help it navigate your body better. Because the nerve is not something we really want to mess with. We can help people all the time with nerve pain. I mean, we had a client and literally last week that had pain all the way down his leg. Clearly he had L5, nerve root was compressed, and we were able to give him the exact exercise that helped take that pain out of his leg. So if you're one of these people that like, ooh, it's really not making it better, it might be making it worse, make sure you get to someone who understands the back so they can help you navigate this. So when we want to stretch the joints. And so this is my favorite exercise. If anyone ever follows me on anything, I always use a towel roll. A towel roll is one of my favorite pieces of equipment. And the reason why is, again, because we can use this to kind of stretch the joints. And it's very It's a great place to start that's not super aggressive, so you can kind of see what your symptoms are. Now, you can make the towel roll bigger and you can make the towel roll smaller. So if you don't notice your symptoms, you're like, oh, I don't really feel anything. Make the towel roll a little bit bigger, and that's how you can kind of progress the exercise. Now, if it's too big and you're like, oh man, that's really hurting, or I'm getting more symptoms down my leg, you need to back off and see if you can make the towel roll smaller and see if you can get those symptoms in the leg to come closer to the back. If you still are noticing that that's not happening, then make sure you get to see someone. I just want to really emphasize that because the nerve is not something that you want to mess with. It is the slowest healing part of our body, and you want to make sure that you're going to someone that understands like how to help you with that if this doesn't work. So let's say my fulcrum is right here in my lower back. All I'm doing is bending. I'm only bending in this section right here. Then what I want to do is I want to put the towel roll above it. So usually where you hurt is where the fulcrum is. And so if you're hurting in this level, you want to put the towel roll above that level because we want to stretch everything above it. The level that we're at is moving just fine. It's the only thing moving, which is why that vertebrae is moving forward, because you're always putting pressure on that one part of the spine. And so you're going to want to, again, roll up the towel, and we're going to place it a little bit higher. So if I have pain right through here, I want it just above that. So you're going to place a towel roll and you're going to lie on your back. And all you're going to do is just lie down and breathe and stretch. If you notice no symptoms at all, make the towel roll a little bit bigger. If the symptoms are a lot, then you're going to want to make the towel roll a little bit smaller. Everyone's a little bit different in what they can tolerate, so that's just how you're going to gauge it. So you just hang out here and you're just stretching those joints because they don't move at all backwards. That only one spot is moving backwards. So we're trying to get the rest of the spine to kind of stretch those joints to get things opening up and moving. So this is how you'll take care of the level above. You can do the same thing, like if your level is higher up, like it's more up through here that the fulcrum is, then you're going to put it on your lower back as well, and you're going to put it up high through here. Most of the time, people have it in their lower back. It's very, 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 very common. So if it's down low down here, then you're going to also want to look at your hip. So I'm going to show you a couple things that you can do to kind of see if your hip is tight. So one way that you can kind of test it is if you get in kind of a kneeling position, and you're just going to want to lean as far forward as possible to see how far that joint moves. You'll do it on one side, and then you'll do it on the other side. So if I come up here and I'll notice like, oh, this joint doesn't move as far. That's a problem. We need to address that because if it's not moving, then if that joint's not moving, if you're trying to get into some extension, the back's going to go and take it. And that one little area that is giving us problems is where you're taking all the stress. So a great stretch that you can do for that is same kind of thing, kneeling, or we can do it lying down. So you can also do it where you're lying down and you're letting this leg kind of drop. If you want something that's going to be a little bit more gentle, just letting that drop, getting everything to kind of elongate. That's one way of stretching it. And you'll just want to hang out here for a good minute, 2 minutes, because we're just trying to get the joint to kind of drop. So you're just breathing as it drops. You can do it that way. Another way you can do it is exactly how you tested it, where you'll just get up and you'll be through here. And you'll literally lean forward, keep the body up straight, and just breathe. As I breathe and exhale, you can feel that joint going down. And again, breathe. That joint's going to be further and further down just to kind of open that joint up. So if you give those exercises a try, you're going to notice that you start moving up above and you start moving down below. The body's going to be moving in a better in unison, better, so that you don't only have one spot that's moving. So give those a try. Let me know how they go in the comment section. Again, make sure you subscribe to our channel. We're always putting content out helping you understand the body better, navigate it better, and giving you tips on things that actually can help you heal your body, getting to the source of the problem.